Hi guys! Welcome again to my YouTube channel, Dr. NeckNeck Explained. Did you know that 15 November 2022, the world reached a population of 8 billion people? So, na-reach na natin ang 8 billion population sa buong mundo. Last 1975, we are just 4 billion. In 2011, we had reached 7 billion. After 11 years, na-reach na natin ang 8 billion. Although, some countries actually nag-slow down na ang growth ng population nila. But the Philippines will still continue to grow. Of course, although may magandang mga side effects ng population growth para sa isang country, at the same time, marami rin itong downsides like our source of food na kumukonti, nagkaka-scarcity, nauubos yung mga farmlands at nagkakaroon ng mga subdivision. May mga competition sa paghanap ng trabaho. Hopefully, ang government natin mabigyan ng pansin ang population growth na ito. Because of this issue, I think it's time for me to discuss about emergency contraception. What is an emergency contraception? Emergency contraception is a procedure wherein the goal is actually to reduce the risk of pregnancy. Ginagamit ito sa mga unprotected sex at dapat gamitin itong emergency contraception within 5 days of unprotected sex. Ano bang ibig kong sabihin ng unprotected sex? Unprotected sex, examples are yung mga sexual assault, yung mga na-rape, na may tendency na mabuntis sila. Ginagamit ang emergency contraception. Ginagamit din ang emergency contraception sa mga unprotected sex. For example, yung boyfriend mo, which is actually irresponsible, nagkaroon ng unprotected sex kasi hindi niya winidraw. Alam naman natin, it's very common in the Philippines yung mga teenage pregnancy, yung mga single moms na iniiwan ng mga partners nila, at ang nangyayari, yung mga single parents na to, mga single moms, nahihirapan silang buhayin yung mga anak nila dahil marami sa kanila iniwan ng mga partner once na nabuntis na. Binibigay din ang emergency contraception sa may failure ng kanilang birth control. Examples ng mga birth control na ginagamit, right? Yung mga condoms. Kunwari yung condoms nag-slip off na alis, pwede kang mabuntis doon. Yung mga nagtitake ng pills, birth control pills, may mga mommies na nakakalimutan nilang mag-take, nagkakaroon ng higher chance para magkaroon ng pregnancy. Yung mga taong mayroon na silang IUD or intrauterine device, kung minsan na-fill off yun o nahuhulog, nawawala, magkakaroon sila ng chance of pregnancy. Yung mga taong nakakalimutan ng magpa-inject ng Depo-Provera on the right time, few weeks or several weeks bago nila maalala na kailangan na nilang magpa-inject pero nakalimutan nila. These are the situations kung kailan mo pwedeng gamitin ang emergency contraceptions. Ang emergency contraceptions should be used within 5 days of unprotected sex. Pero mind you, the earlier that you use the emergency contraception, mas higher chance mo na hindi ka mabuntis. For example, may unprotected sex ka at nag-take ka ng emergency contraception within 2 days, within 3 days, you have a higher chance na hindi mabuntis compared sa 5 days. Although, it is advised na ang emergency contraception should be used within 5 days of unprotected sex. Remember that emergency contraception is not used as a primary birth control. It should be used only for occasional situations, for an emergency situations lang. And it is not an abortive procedure or abortive pills also, because mayroon ka ng pregnancy at ginamit mo ang emergency contraception, hindi niya ma-harm yung pregnancy mo, hindi niya marireverse ang pregnancy mo. Kung pregnant ka na before mo gamitin ang emergency contraception, magtutuloy pa rin ang pregnancy mo. There are two ways how pregnancy is being prevented, or two actions of emergency contraceptions why pregnancy is prevented. First one is it prevents the sperm to fertilize an egg. Second one is it prevents the fertilized egg to implant in the uterus. Yun ang actions ng emergency contraception. what are the types? Ano yung mga types ng emergency contraception? Number 1 is actually the intrauterine device. Actually, intrauterine device is the most effective emergency contraception that is being used. So, may ini-insert silang instrument, malit na instrument, within sa uterus. It is done by a healthcare professional. There are 2 types ng IUD. One is actually copper-containing and the other one is hormone-containing intrauterine device. Second choice of emergency contraception is the pills. Ang pills, there are 2 types. Pwedeng hormone-containing pills na nagpre-prevent ng pregnancy like your levonorgestrel, or yung pills that prevent a pregnancy hormone such as ulipristal acetate. Yung birth control pills, sometimes they also use as a emergency contraception. Dinodoble lang nila yung dose nila. First dose, then after second dose will be 12 hours after. Your OB-GYN will explain this if you need an emergency contraception. So if you need an emergency contraception, ask your doctor what is the best for you. I-discuss nila kung ano yung best fit for yourself. So, emergency contraception is now marked as Dr. NeckNeck Explained.